Today, we're diving into a topic that's been buzzing around the FDA's radar: compounded semaglutide. Is it safe to use? Let's unravel the mystery together, so make sure you stick around. All right, buckle up, folks. We're kicking things off with a red flag from the FDA. You know, that little government agency that keeps an eye on what goes into our bodies? Yeah, them. So, the FDA has raised its eyebrows at compounded versions of semaglutide. Why? Well, because they might not be the safe and effective solution you're hoping for. Now, before we get into the nitty-gritty, let's break down what semaglutide actually is. It's not your typical name, right? Semaglutide is a superhero in the world of diabetes and weight loss. It's a glucagon-like peptide-1, GLP-1, receptor agonist, which basically means it plays nice with the hormone GLP-1 in your digestive tract. Approved by the FDA, it comes in different forms like Ozempic, Rybelsus, and the new kid on the block, Wegovy, which is giving weight management a whole new meaning. But wait, what's this talk about compounded semaglutide? Well, compounding is like the mixtape of the pharmaceutical world. It involves mixing or changing ingredients to create a new medication. Sounds cool, right? But here's the catch. Compounded drugs aren't FDA approved. And when it comes to semaglutide, the FDA is throwing some serious shade. Now, the million-dollar question: is compounded semaglutide safe? The FDA isn't doing jazz hands for these versions. Reports of compounders using salt forms of semaglutide have set off some alarms. And here's the kicker: the FDA hasn't found a valid reason for compounding the drug this way. It's like trying to remix your favorite song, but ending up with something that just doesn't hit the right notes. Okay, let's talk side effects. Nausea, vomiting, stomach pain. It's like the unwanted playlist of potential reactions. Semaglutide already has its own list of potential side effects, and when it's compounded, things can get even trickier. We're not just talking about feeling a bit off. We're talking potential health complications and even the Grim Reaper knocking on the door. Hold up, there's a new player in town, Tirzepatide. It's like the cool cousin of semaglutide, stimulating not one but two hormone receptors. It's got potential, but the FDA hasn't given it the green light for weight loss yet. We're keeping our eyes peeled for this one. So, what's the big takeaway from all this? If your doctor thinks semaglutide is your go-to superhero, steer clear of the compounded versions. The FDA has sounded the alarm, and we're here to echo it. Your health is the real MVP, and sometimes the shortcut isn't the best route. Always consult with your doc about the safest way to get your hands on semaglutide and explore alternative options. Well, that's a wrap for today's episode. If you found this info as mind-blowing as we did, hit that like button, subscribe for more juicy updates, and drop your thoughts in the comments. Stay informed, stay awesome, and until next time, peace out. And remember, your health is non-negotiable.